Hey everyone, it's Ian again from Vintage Valorware. I had mentioned earlier when I went over my kits that I wanted to talk to you quickly about hemostatic agents. It's important to note first, before we go into the two types of hemostatic agents, that they're not magic. They don't work without your steps to control bleeding, which are direct pressure, elevation, yes, pressure point, wound packing, and tourniquet. You have to master those steps to control bleeding to maximize the effect of the hemostatic agents. Just the hemostatic will not help you if you have zero skills. That's why we go to classes like Stop the Bleed that are offered for free all over America. Stop the Bleed classes are essential for anybody that's in the public, around schools, or around any type of groups, or has a large family. I would go to a Stop the Bleed class. I'm getting off topic. Sorry about that. I wanted to talk to you about the hemostatic agents that I use. I personally use Celox. The reason I use Celox is, these are the different forms, is that it doesn't need to work through the body's clotting cascade like quick clot does. The body clots. Your body will clot through several steps. The quick clot skips a few of those steps. I'm simplifying this slightly. Skips a few of those steps, and that's how it acts in its hemostatic way. It jumps ahead and lets you and starts to activate clotting faster. The Celox doesn't need to do that. The Celox acts on its own. It's a chitosan-based compound. It's a shrimp shell dressing. It's a shrimp shells. They're masticated down to a powder. And these that you see in front of you are gauze impregnated with the Celox material. So if I was to open one of these, what it's going to look like is a yellow, hard gauze type material. And it's just gauze with the Celox heavily impregnated in it. It doesn't bend as well as gauze. It feels kind of like a very lightweight cardboard. These are the different forms that it comes in, the different packages. The Z-fold is what you'd see in like a battlefield medic, a combat medic, somewhere you'd have some of these Z-fold types. It's, as I said, it's gauze impregnated with the Celox. The Celox works by making a clay-like plug in the area that you need to stop the bleeding on. So it's going to make like a plug, like a glue-like plug. It absorbs water also through a different chemical type of reaction with the blood than the quick clot does. I like the Celox because when the clotting cascade is inhibited, like in hypothermic patients or patients that are on some type of med that I don't know, for instance, like a blood thinner or something like that, and the clotting cascade is affected in that respect, the quick clot won't work as well as the Celox. Because the Celox, remember, doesn't need that. It's working all on its own. So I like to use the Celox. And I like the different forms, honestly, which we will go over. If you pan it down for a sec. This is Celox gauze. You're going to see it's pretty often packaged just like this. It's usually good for 2 to 3 years. I keep it beyond its date. I mean, nowadays, who knows about expiration dates or what the deal is. It's up to the specific medic and their resupply and the logistical chain about what they're going to do with their stuff. These are the forms that I've used it in. This is one, as you can see, it's from the UK. I've used it in Africa. It's just an example I use for training. It's the same stuff as this, just packaged in a different way. Celox Rapid, it's also gauze, just it renamed. It's gauze. It looks just like this does. If I would open it, it's yellow gauze impregnated with the Celox, the chitosan material. This is one of my favorite types to use. It actually isn't the gauze, it's the Celox powder itself. And the reason I like this one is because it comes in what's basically the paramedics used to call a Bristojet syringe. This is the barrel of a syringe, the circular section. this is the plunger. When you open this, you take the plunger, you put it into the end of the barrel, and at the end of the barrel is an opening where the powder can be pushed into the wound. So it's really good for puncture wounds. Where wounds where there's some missing tissue, I may use something like the gauze itself to fill the area where the tissue is missing. But I really like the Celox powder, this itself. There is no gauze in here. In other words, this is Celox A for Celox applicator. So this is for more like puncture wounds. I carry 2 or 3 of these on me, in my bag, actually. This is Celox Rapid, something this small. It's the same version as this, but it's a small, thin strip of gauze impregnated with Celox. The shrimp shell dressing one. I like this one because it's easy to carry. This goes in my first line kit that I showed you in the first video. As you can see, I've carried it for months. Probably time for me to get another pack because it's getting kind of beat down. So these are the different forms of Celox that I would use, that I have used in the past. The reason I like the Celox over the Quick Clot, which I will discuss in a second, is I don't need to touch the clotting cascade in the body. The Celox by itself will make it plug by absorbing the water, and it's got an electric at the chemical level, it's got electrostatic charge that it helps stop bleeding in that aspect, instead of using instead of having to depend on the body's clotting cascade like the Quick Clot does. This is the kaolin-based hemostatic agent that we see in the regular, I use these in Africa by the dozens, packed just like this, as a matter of fact. You'd see them here in the ambulances. First responders would carry versions like this. This is a smaller version of this same gauze. Now, this is gauze also just impregnated with the Quick Clot, the kaolin-based powder. None of these things, remember, none of these will work by themselves. None of them are magic. You still need to use your bleeding control techniques. And whenever either of the 2 versions is used, you still have to use at least 3.5 minutes of direct pressure. So those are the 2 forms of Quick Clot. Now there's some tricks that I wanted to talk to you about also. So I use the Quick Clot, I use the Hemostatics, whichever hemostatic I have. Hopefully it's a Celox of my own. And you could gauze on top of it. And I would pack this gauze, extra gauze, on top of the wound. And then I would use direct pressure for at least 3.5 minutes. The problem with direct pressure is, as a step to control bleeding, it's really hard to move the patient when you're doing direct pressure, because you want to trap with whatever area that's injured. It's usually a limb against something hard like the ground. And when I say direct pressure, I don't mean direct pressure like light pressure. I mean your whole body weight. Basically, it looks like a CPR compression that you're not letting up of. You use both hands and your entire body weight on the limb. You want to trap the limb between your hands and whatever's harder that the patient's laying on, whether it be, a kitchen floor or the grass outside or the concrete. And you want to maintain that pressure for 3.5 minutes with any of these hemostatic agents. I like to use the packing stick instead of my fingers, because of the reasons that we talked about earlier. Because whatever caused the wound could still be in the wound. Also, a lot of times when you have traumatic injuries, they're multi-system. They've caused soft tissue injuries, but they've also shattered bone. So anybody who's seen what a broken bone looks like, or a chicken bone, if you can imagine how sharp that is, and you sticking your fingers in there, it's usually not a good idea. So I use a packing stick. Now, the reason I have this is a chest seal. This is going to be another video, but everything I have can work in conjunction. They can all work together to augment what they do. So I would use my hemostatic, let's say my Celox Rapid, for an injury. I would fill the wound with this. I would pack it with my packing stick. I would pack the gauze on top. Then I could open the chest seal and I would put the chest seal over top of the injury. So I'm making a dressing. Once I did that, I would hold direct pressure and I would move. You see, the chest seal can be used for more things than just sealing a chest injury. You can use to put a dressing on a burn that's maybe 1% size, hand size, and then you can seal that wound, that dressing material, with the chest seal. So the chest seal, it's all limited. All these devices are limited by the medic's imagination. And I would encourage you to open your things, look through your things, and practice with them and see what you like. And maybe you like quick clot over Celox. Maybe your medical control will only allow quick clot like they do in Connecticut. Celox is my choice. Celox is what I'm used to using. I like the forms that it comes in, and I like the convenience of my little Celox A as my first line. Again, Ian from Vintage Eyewear, and have a good day. Be safe.